It's like
अच्छा,
that.
ओके ओके. अच्छा, फीमेल की बात कर ली, मेल्स में सबसे कॉमन कैंसर्स कौन से हैं?
So unfortunately, in our country, the worst cancers and most common are tobacco-related cancers. So unfortunately, so in males, the most common cancers in our country are head and neck cancers. So head and neck because smoking, chewing tobacco, gutka, pan masala, supari. So if you take the head and neck region as a whole, so include the lip, tongue, mouth, buccal mucosa, throat. If you take them together, they are number one in our country. If you separate them, that
ये तो सेल्फ इम्पोज्ड काइंड ऑफ हो गया.
so if you separate these, then prostate cancer is number one
Prostate.
in our country. So
And that can be easily be diagnosed with a
that can
blood
be
test.
easily diagnosed. So main thing is that diagnosing prostate cancer for a man is so much easier than diagnosing breast or screening for breast or cervical cancer for a female. Because mammography, they have to go to and get an X-ray of the breast. And for pap smear, they have to go to a gynecologist. Well, a man can just give a blood sample.
That's it.
That's it. If the PSA is high, they can go and visit a doctor. That my PSA is high, what should I do? So screening for prostate cancer is very, very easy. So although it is not part of the guidelines, patients who are heavy users of tobacco, okay, so they have the option to screen for mouth cancers and lung cancer. So we see in our country actually chewing tobacco is very, very common.
Very common.
So pan masala, gutka, supari, it's very, very common.
Yes.
So my suggestion is, although it's not part of the guideline, national guideline, is people who are active tobacco chewers, they should get a medical checkup of their mouth done at least once a year. Either from a, they can get it done from an ENT doctor who is near them or from an oncologist. And the doctor can just systematically look at all the folds in the mouth. Just like between the cheek and the teeth, there's a fold. So you may not be able to catch something growing there unless somebody carefully looks for it. So they can just carefully examine the whole mouth, make sure nothing is wrong, and they can reinforce to that person that stop tobacco, and the person can go home. So, and second is lung cancer. So
Smoking.
Yes. So it's actually possible to screen for lung cancer. So a lot of people don't know that you can actually find lung cancer early. Okay. So a lot of people think you can just do an X-ray. The problem is by the time the tumor is visible on X-ray, most of them are stage 4. If the tumor is visible on X-ray, there's a very high chance it is already stage 4. So lung cancer screening is done by a yearly CT scan. So patients who are heavy smokers, they have smoked for 20, 30 years, who are still smoking, or they have, it's been either they have not quit in the last 15 years or they are still smoking, and 20 pack years. So we have something called pack years. That person is smoking at least 20 cigarettes per day for 20 years. That
pack
is,
years.
that
Achha,
is
one pack has 20 cigarettes.
One pack has 20 cigarettes.
Okay.
So 20 pack year is 1 pack a day for 20 years. Okay. Or half pack a day for 40 years. So you can calculate like that. So patients who have that much smoking history, they can get a CT scan done once a year. And it actually saves lives. Like we can catch lung cancer at a very early stage.
Okay, what about somebody who chews tobacco but spits it out without ingesting it?
Okay.
So my
First
dad
of all, he
is...
should be beaten up. Okay, because he's creating a mess of all our trains, all our metros, all our public utilities. Even my park gate, it is covered with red sput up. So first of all, we need to catch him and beat him up once. But
okay.
When they are chewing tobacco, to get the maza out of that tobacco, they have to keep it in contact with their mouth. So somebody who chews pan masala, you can't just chew it and spit it out. When they chew it, they keep it in contact in their cheek so that the nicotine dissolves into the blood. So when they put that in contact, it has to remain in contact for some minutes. And along with nicotine, all the cancer substance also gets exposed to the jaw and the mucosa. So the problem is that even if they spit it out, they are spitting it out after taking the full exposure of carcinogens. So it's just like somebody who smokes. So there are some people who don't inhale. They just take the smoke in their mouth and they exhale it.
I didn't know that.
So cigars, for example, cigars are not supposed to be inhaled. People who smoke cigars, they just fill it in their mouth and they exhale it out. And it is supposed to be absorbed by the mucosa of the mouth. So they are predisposed less to lung cancer and more to mouth cancer. So wherever that exposure is there, patient will develop that kind of cancer.